Hello colleagues, it's now been over a year since we admitted our first patient with COVID-19 to the Belfast Trust. I want to invite you to spend the next few minutes listening to our journey of this incredible year. It is a testament to your courage, resilience, selflessness and compassion. I am so proud of each and every one of you, and I want to thank you from the bottom of my heart.
Looking back, there was definitely a fear, anxiety, the unknown of what was to come. Definitely it was one of the most terrifying times you can ever imagine as a nurse on the front line. We supported each other just via speaking on the ward, having our safety huddles and talking to each other. It's very difficult to make sure that everyone is getting the support they need, and it's just making sure that you take some time yourself and deal with your own stress too.
As a world, we were not ready, and certainly in terms of Europe and the UK, the clamour for the things that we needed to do those tests, the reagents, that there was going to be a big shortage, there was going to be big supply chain problems, and that was exactly, and particularly during February, March and April, that was a really big issue, and it meant that we had to engineer in lots of redundancy, lots of different ways of doing the tests, not the way that you would choose to do it, and it became clear over that period of time, probably during February and beyond, that we were going to have to scale up and do testing at a scale that we had never done for any infectious agent before in our lab, and the turnaround time getting these tests done quickly with the result back was going to be very important.
The first thing was a true sense of disappointment that here it was happening. I always thought it was inevitable and it was, going to happen, but obviously having it here in Northern Ireland was a true disappointment. It made it really real, whenever the first patient was identified.
It was quite a surreal thing to completely decant a hospital and empty all the wards of all the inpatients in preparedness for what was coming our way. And when we knew, we met and we were told that it was going to be the designated hospital site for COVID inpatients across the trust.
I'm Nick, and we are the Belfast Respiratory team. We are now in the greatest medical crisis of our lifetime. Stay at home.
We just felt that the message wasn't getting out there to the public. It was a mixed message at that time, and actually we filmed the video on a Sunday, and the next day then the country went into lockdown, essentially. And at that time, people didn't really understand how important it was to stay at home. And we thought that as a group of respiratory physicians working in the Belfast Trust and all the allied health professions working in respiratory, that we could get the message across.
I think the message resonated with people because it was honest and it was true and it was how we were feeling. And we were very worried about the people, particularly across Belfast, obviously across the whole region. So somehow or other, through local contacts, Twitter, Facebook, it just kind of took off.
And I think at the start people thought, it won't come to Northern Ireland. It won't come to Northern Ireland. Of course, we'll miss it. But we knew that it would, and we knew we had to be prepared. We were worried about the numbers of patients, about how sick patients were going to be, how we were going to manage them. At that time, there were no studies involved in looking at patients with coronavirus. We didn't know what the best way to give them oxygen was, what medicines to give them, but we knew that we had to give them good supportive care. We knew that we had to, as a team, work together and look after these patients in the best way that we could. And as a group of respiratory physicians, we came up with a plan and a protocol as to how to manage the patients so that anyone who was looking after the patients was able to do that.
I was completely bowled over by the response of the staff in the Mater Hospital. The collegiality and the collaboration across the whole hospital was really humbling. It was unbelievable how a team, a group of teams could come together with a common goal so quickly and make such huge, massive changes to a site and to services in such a short space of time.
Knowing what the urgency and the complexity and the seriousness of some of those surgeries that patients were then going to be delayed and not going to have at this time was quite disappointing. However, in the first surge, patients were anxious as well, and so were other staff, and nobody actually fully understood what was the impact of COVID for people if they had surgery or if they were ongoing with their cancer treatment. So again, we had to look at protecting patients as well, so that we didn't have more mortality associated with continuing with certain treatment and therapies.
We didn't know how much COVID was in community. We didn't know how many patients were symptomatic or simply unwell. So it was the whole unknown entity of it that was the biggest challenge, and the fear and the anxiety.
District nursing changed hugely. Normally we only go to the strictly housebound patients. However, the housebound ethos increased massively. People received shielding letters, they were to stay at home, and even older people just felt vulnerable, and their relatives weren't happy for them to attend treatment room or clinic, and that's where district nursing very much stepped in, and people really relied on us.
Beech Hall had a purpose-built clinic room area. It was sort of 8 to 10 days in the planning, very intense planning, very long days. Very much a collaborative partnership between GPs and the trust. Ourselves as clinicians were able to say, well, this is what we need for safe processes. So everybody had an input, and we needed everybody to be part of the team, from infection control, from PCSS, sort of cleaning areas, from the reception staff, the buildings, the facility staff themselves. So it was very much a collaborative piece of work, so that we could give the GPs the safe space to carry out their assessment, but as I say, also the safe space for the patients to come through.
We then had to obviously plan for, well, what would this mean for us in the Belfast Trust, and what did we need to do, what steps did we need to take to create the capacity for that. So that was about the early training of staff, and particularly for the intensive care, knowing that we hadn't got enough staff with the skills to be actually coping with the numbers of projected patients that were likely to need critical care facilities.
Our normal nurse to bed ratio in intensive care would be 1-to-1 with an intensive care nurse. So we realised very early on that we wouldn't be able to deliver a 1-to-1 nurse to bed ratio with a trained ICU nurse. So we had to look at, with the increase in demand for ICU beds, we had to look at how we could still maintain a 1-to-1 nurse to bed ratio. However, it might not be a 1-to-1 ICU nurse to bed ratio.
So we were working on a 1-to-2 nursing ratio, which is why we had so many redeployed non-critical care nursing staff. So our normal ratio would be 1-to-1. So because of COVID, we then had to expand what we normally do. So it was supporting the staff throughout all of that and ensuring we had adequate staffing every day and the ability to admit, because we didn't know how many patients were going to come, and also it was winter time, which means you don't just have COVID, you have other people requiring critical care beds with normal things like pneumonia and flu and sepsis, all the other stuff that we would take care of on a day-to-day basis.
I think the most important thing was the reaction of staff, and while there was an immense amount of fear as to how are we going to deliver services safely and protect ourselves and protect our families, the response and the attitude of staff was so positive, so overwhelming. The amount of volunteers that actually came forward in the first wave to work in the COVID centre was heartwarming, it was reassuring, and it showed you the dedication and the professionalism of the staff.
So the Nightingale really went from an ICU HDU capacity of about 13 bed spaces to up over 200 bed spaces, and that was done by increasing the availability of oxygen at all the bed heads. Hundreds of additional outlets were provided, additional power supplies were provided. The interior of the wards were reconfigured to give separation, to create COVID-safe spaces for patients and staff. The ventilation system was reconfigured and our oxygen storage capacity was tripled.
The funny thing about the Nightingale Hospital probably wasn't the stuff we did to get it up and running. A lot of it was about how we supported services moving out. So that was the thing, was the readiness for the Nightingale. So, there was setting up the Ramada Hotel, turning that into a step-down facility. That was working with the independent clinics to be able to move services out, oncology going out, into Ulster Independent and areas like that. That was last minute, that was urgent, and it was getting that up. When we had those initial conversations, we had no idea how we would make that happen.
The skill set within ICU and the numbers of staff that we need in ICU per bed are quite significant. So we developed a workforce model, and that was in line with the rest of the region, and that was supported by the Critical Care Network in Northern Ireland to look at how we could train our additional nursing staff to work in ICU, and also to make sure that we delivered safe care to our patients in ICU.
It literally felt like working in a war zone. And I remember a consultant actually saying to me on that day, don't you cry, because if you cry, I think I'm going to cry. And that really resonated with me, because that kind of made me think, this is serious, this is something that you can prepare for to an extent, but you can't prepare for it until you're actually in it and understand what's going on. And everybody's wearing face masks and visors and PPE, and you can't hear what people are saying to you. You don't know anybody except for a sort of name badge on their visor to tell you who they are. So communication and all of those things were really, really important, and we didn't really have a lot of time to put in place everything that we needed, and because it was so unknown, I wasn't really sure how much preparation you could do. Like I say, you could prepare to an actual point, but after that it was learn as you go.
I mean, I was reasonably fit. The day before I came down with COVID, I was in the gym, I was doing stuff, I was active. I have 3 young children. And then whenever I came round, literally could do nothing for myself. I remember the very first thing was they asked, did I want a drink? And I asked if we could get a fruit drink. They gave me an apple juice. Best drink I've ever had in my life, let me say. And I remember literally trying to get the straw to my mouth, that I couldn't do it. I needed help to do that. I was completely bowled over by the care that I received. It just amazed me how the only word I can use is loving. How loving the care was that I received. I could do nothing for myself, and I don't want to paint pictures, but I could literally do nothing for myself. I had no dignity. I was completely dependent upon the staff, and not once did I get anything but care, support, interest, encouragement. All the things that the staff did for me, it just completely and utterly overwhelmed me.
The initial thoughts and actions were around the staff and the staff protection, because the staff themselves were very anxious. Apparently, especially the staff dealing in the front line, that were seeing what happened, heard of colleagues elsewhere and their demise, and the fearfulness of the situation for them.
By the end of December coming into January, we had 68 million pieces of equipment had come through the store. It's just mind-blowing. I mean, we started off ordering maybe 5,000 masks, and at the minute we're going through maybe 200 to 300,000 masks every week.
The first feedback that we were getting was about PPE and people being trained properly to effectively wear the PPE, keep themselves safe, getting people trained, and then it moved on to staff being redeployed. The initial fears were, like any pandemic, how's this going to impact on me? Am I going to be safe? And then it progressed on to the need to effectively give people information in a timely fashion so that we could allay some of those concerns, that we could address some of the issues. And the most important thing that we learned out of this was fast, effective communication to people.
At the beginning, when we first sort of started this, I mean, I'll admit it was scary. You came in and you were afraid, and I could see in my staff they were also afraid. Everybody, no one understood what this virus was at the time, really. And then we were getting prepared. We were going to meetings and being prepared for things that, you know, and we were being told things that we never thought we'd ever do in this job ever. And we have seen a lot in this job over the years.
We went away thinking things were going to change, and we came back surely on the Monday, and we had to help. Lockdown had started or was starting, and we had our priority was to help our young people understand what that meant. And that's the bit I remember, because the young people, the routines they have with school, the social outlets they have, the family contact they have, everything just went for them overnight. And that is what, in terms of what this was going to mean, it really hit us in terms of how we were going to support our young people to understand, because for them, they couldn't see the virus, they couldn't see what it actually was, what it meant.
On Christmas Day, we took a patient from the ward to the children's hospice, where he was able to make a bubble with his parents and his siblings for the day. So that was a real honour to be for our team to be a part of that, you know, so that he was able to make special memories with his family, you know, away from the hospital environment.
The appeal went out to our trust staff, and through a lot of engagement with them in explaining what that role would be, and really what helped ultimately was really hearing the stories from our care home colleagues themselves in terms of the impact COVID was having, and trust staff that were wanting to give their time and to actually do something in terms of supporting our residents that we've placed in those homes and ensure that they got continuous delivery of good quality, compassionate care.
Now it turned out, I think we built our systems around about 1,500 people being able to access remotely at any one time. And before the pandemic started, you'd normally have about 40 to 50 at any one time working remotely. And we topped out at about 1,300 people. So we were able to cope with it just about.
In terms of the national effort, you know, we all recognise that testing our staff is absolutely key, so that we can quickly, you know, identify those staff who may potentially, you know, be COVID positive, that they can, you know, take the appropriate measures in place, that, you know, they're not, you know, spreading the virus around their work colleagues and potentially taking other colleagues out. So working very closely with our occupational health colleagues and those staff involved, and that was absolutely key to us ensuring that we had as many staff as we possibly could in the workplace. So testing was absolutely fundamental. Equally, you know, the vaccination programme now is key to ensuring that we keep as many of our staff in the workplace as we possibly can.
Our support role evolved as time progressed. We started out with the advice line on the 10th of March 2000, and then that evolved into initially making appointments for staff to get COVID tests. And then we were involved in the results process, where we were providing results to staff. And then later on in August, we developed our contact tracing team, where we were identifying workplace contacts for staff who had tested positive for COVID. So it really evolved very rapidly throughout, and that support to staff was very vital at each point that a staff member would have contact with us.
One area that we developed was psychological helpline, and that was with psychologists who were providing a confidential listening ear to staff, and to help them, support them with their legitimate worries, because staff have a right to be anxious and a right to be concerned, and it was really just to provide a listening ear and to point them in the right direction in terms of support.
Me and Tony were friends. That's the way we looked at it. We all, and there's a lot of us, all the supervisors, like within the PCSI, we were all friends. We weren't colleagues. We looked upon each other as friends. There's something missing. There's just something missing. Everybody knows Tony will tell you heard Tony before you seen Tony, and there's just something missing now, because when you walk around the corner you would usually hear Tony before you seen him, and then it is sad you're walking around that corner and you don't hear that anymore.
The
the couple of weeks after, I mean, my phone never stopped with well wishers and the amount of emails, and to be honest, I probably haven't even got around to speaking to half the people again. But the amount of people just even ringing who knew him throughout this site. And I actually think it was a big shock to Deborah and his son how many people actually knew him on this site. When you go on the Belfast Live Facebook post, when they were sort of announcing it, the amount of people commenting underneath it who were trust workers, I think that was a big shock to Deborah, and hopefully it was a bit of a comfort to her as well, and to Cara, that he was greatly missed by so many people.
She was my best friend of 60 years. We went through our childhood and our teenage and adulthoods together, and we just were inseparable really. She's more like a sister, which people did think we were sisters. She was a very caring person. And then I sit back and I think, how did she ever divide herself out among people? And she was quiet and she'd have been in the background, didn't like a lot of fuss. But yet if there was a gathering or, we were out, she would have been the first to lift the guitar and start a sing-song.
There was a sense of loss for everybody, and I pay tribute to the way the staff actually had dealt with it. They had obviously, at the funeral corteges and gone out and shown their mark of respect, and that was hugely emotional, to actually witness and see that.
We remember with sadness the many people who have died during the past year, especially family members, friends, and trust colleagues. May memories, love, and prayers be a source of strength and hope. O God, bless all staff as they continue to offer compassionate care and show selfless courage in the face of risk and challenging circumstances, and give strength and support to those who continue to live with the impact of their loss. Amen.
Everybody was so relieved to hear that there was a vaccine that was available for this, because it was our light to get out of this pandemic. It was the only way forward. So it was exciting, challenging to set up the vaccination programme. I think the first thing was to understand the actual management of the drug.
The Pfizer vaccine was the first one to be approved in the UK, and its rollout was very quick after that. The vaccine itself is stored at between -80 to -60 degrees, which is a frozen type product that we wouldn't necessarily have ever kept within the trust. We didn't have the facility to hold it here, so once it got here, it would come in a dry shipper. With the dry ice as well, so that allowed it to keep at that temperature. But then even then, that shipper has a life on it. So then at that point, we'll have to take it out to thaw, and then whenever we thaw it, it has then another 5-day expiry, and then that has the pressure on making sure you use that stock up prior to going out of date.
Second thing was obviously finding a location. And thanks to our estates colleagues, they actually came up with the idea of the location that we are now in the non-clinical support building. And I have to say our state colleagues played a blinder in getting that building ready for us, and all the infrastructure outside and the signage and whatever, which has just been immense in such a short space of time. It was really great when it came the 8th of December and we were able to start our peer vaccination, and that was an immense day for us. I think really emotional for a lot of people. Plus it was we did the first care home on that day as well, and again I think that was for the residents and the staff and the care home sector, that was very emotional for them. So it was a real privilege to be able to start the programme and to include care homes in that.